Hi everyone, my name is Sam and welcome to my channel RN to Patient. Today I'm going to be talking about my rare cancer diagnosis. I was diagnosed in November 2021 with primary mediastinal large B-cell lymphoma, a form of non-Hodgkin's lymphoma. The reason why I want to share my experiences is because being a young adult with cancer at such a young age is a very unique experience, and I find that there is not a lot of resources and support out there for those of us in this situation. Going forward with this channel, I plan on serving as a support system for young adults with cancer, their caregivers, their family members, and just as a resource for our healthcare workers wanting to know more about what it's like to be a young adult with cancer. All right, let's get into my story as to how I was diagnosed with a rare form of cancer. So in July 2021, I had left my staff nursing job at a local ER in my area. I decided to become a travel nurse. I then traveled to a hospital that was about 4 hours away, and I loved it. It was a great change in my life. Things were going great. I got to travel, see new places, have new experiences. I also got to meet a lot of great new people at my travel contract. So, beginning of September 2021, I started having like this vague feeling of like heaviness in my chest. I couldn't really pinpoint it. It really just like at nighttime I noticed it, but it would leave my mind quickly when I got up. Um, I noticed when I was like laying down, I just felt this weird heaviness, like I couldn't quite get comfortable. I started sleeping on my left side a lot and also on my belly because I just couldn't quite get comfortable otherwise. At this time, I also was starting to have this weird, like, congested shortness of breath, not quite shortness of breath, but like congested feeling in my lungs. I noticed it especially when I was walking to and from my car at work because there was just like a slight incline from the ER that we walked out of up to my car. I remember thinking at the time, like, this is either allergies, because in the fall I sometimes get like allergies, or like I thought it was like allergies, maybe I was starting to get asthma, or like I started thinking in my head I was getting, out of shape. Man, like maybe you're just getting out of shape, you need to work out more. I really just thought it was just something dumb going on. I didn't think that it was anything serious, and oftentimes I would leave my head pretty fast. Like I wouldn't think about it constantly or worry about it. And then about mid-September of 2021, about a couple weeks later after my symptoms started, I remember waking up. Again, I was waking up in the evening. I actually worked night shift at the time. But I remember waking up and I had this like weird, heavy, like something was in my chest. I don't know how else to describe it other than it was deep in my chest and I had like this weird, heavy pain. And as the day progressed, like I got ready for work. I drove to work. By the time I drove to work, I was like almost in tears. The pain was just, it was just really aggravating, and I started to worry. I just felt that pain. When I walked into work, one of my coworkers noticed, and I kind of told her what was going on, and I said, it's probably nothing. It's probably a pulled muscle or something, like it, and I tried to like brush it off, but thankfully at the time, her and as well as a few other coworkers were like, no, you should get checked out because even though obviously no one thinks it's cancer, it could have been a blood clot or something else going on. So I ended up getting checked out. They did, routine things. If you work in the ER, you would know. But basically, they did an EKG where they put stickers all over your chest and they watch your heart monitor, like your heart rhythm, to see if there's any abnormalities. They also did blood work and chest x ray. When you go to the ER and you have chest pain, there are a few different blood markers that they look at. One of them is called a troponin, which is a cardiac enzyme that is released when your heart starts having damage. It can indicate a few different things, but the most common thing is heart attacks. Obviously, that was negative. I wasn't having a heart attack. I wasn't having cardiac damage at the time. They also checked another marker called D-dimer. Again, the D-dimer can increase for various reasons. Even simply just being sick sometimes increases it, but it is also a decent indicator as to whether or not you have a blood clot. All of those came back fine. My EKG was fine. My x-ray looked okay. There was really just nothing that pointed to anything. The doctor that was taking care of me at the time, which I would like to say had excellent bedside manner, was very nice to me. He did everything that he should have done. He did everything right. He felt that this was, maybe it was like a little bit of pain with anxiety, or it was I pulled a muscle and it was just like a lot of musculoskeletal pain. And I remember feeling so embarrassed and just frustrated because I felt like I just wasted everyone's time and I felt ridiculous. I remember just looking at him and I said, I just feel like there's this pain like inside my chest. He was great. He referred me to a doctor in the area. He also told me I could follow up with my primary care doctor. It was really hard to get in with my primary care doctor at the time because I was 4 hours away and I wasn't going home very often. But it was also hard to get in with a doctor there. So it ended up falling to the wayside within a couple weeks. I ended up only being there for a couple more weeks also. I don't really blame anyone, especially not the doctor. He was great. Unfortunately, because of the situation and the standards that we as healthcare workers follow, my tumor was essentially missed. And unfortunately, that's just how it played out. But that was the first instance where I started to really have some concerning symptoms about this tumor. Also, ironically, the doctor that saw me in the ER told me that, we don't really like to scan people your age because of the risk of radiation, etc. And while I totally get what he was saying, just how ironic it was he said that. And then later on, I ended up needing so many CT scans. I get PET scans regularly. I had to get radiation when my cancer came back, which is a whole nother video we'll make about that. But yeah, I attempted to make an appointment with my primary care doctor, and they kept on telling me, well, if you're having chest pain, go to the ER. And I'd be like, okay, well, I'm trying to follow up from my ER visit. And they kind of gave me the runaround on it. And by this time, I felt like, you know what? It's stupid. I'm 25 years old. There's no reason why I would have chest pain. What am I doing here? I probably am just fat and need to lose weight. Or it was just in my head. It could have been anxiety. I do have a history of anxiety. I take medication for anxiety. So that was like another thing that went through my head. So I ended up not following up on it. 2 weeks later, while I was at work, I then injured my back while taking care of a patient. I pulled it. I actually sprained and strained my lumbar. So I ended up getting sent home from my contract early. I had to end my contract early. I had to go on workers' comp because I injured my back pretty bad. So the whole month of October, I was stuck going to a spine specialist, chiropractor, and I started to notice at my last appointment at the chiropractor, because I wasn't able to make up any of my other appointments after that. So this was like end of October, beginning of November. I started to notice like this weird heaviness. Like I started having a really hard time laying down on the chiropractor table. And like I just thought I was getting sick with something. Now, obviously, looking back, I was like, wow, like how did you not understand or realize how severe like laying down and how your shortness of breath, like how bad everything got? But it's also easy for me to look back like that Because at the time, all of my symptoms were very gradual. They happened over a couple of months. It's really hard to really notice how much things have changed in terms of your symptoms and shortness of breath when it happens over a time span of 2 months versus, say, like 2 days. So I had a hard time breathing on that chiropractor table. And then that weekend, I actually started getting sick. I started having fever, flu-like symptoms, and I ended up getting a COVID test, a flu swab, because I was trying to still make my appointments. And if I didn't have COVID or the flu, like obviously once my fever broke, I wanted to be able to get back to my appointments. So I tested negative multiple times. This included tests at home as well as drive-up tests. And I kept on testing negative. That next Wednesday, I was feeling a lot better. I started feeling a lot better like 2 days prior. I remember feeling a lot better, but I still felt super congested. I felt like I had asthma or bronchitis or pneumonia or something, and I had this terrible cough, like this terrible barking cough that I would cough so hard and I would get like dizzy and feel like I was going to pass out. Like that's how hard I would cough. Again, I kept on telling myself, I'm overreacting. It's probably nothing. I'm a young 25 healthy person. Like this shouldn't be a problem. But since other than my cough, I was feeling better, I still went and saw my sister and my mom. We actually went out to like an art exhibit experience thing is the best way to put it. But we went out and I remember my mom just looking at me like, oh my God, like your cough just sounds terrible. And she made me promise that I would get it checked out if I didn't start feeling better in a few days, which I did. The next day, my breathing started to get worse again, and the cough was still there. So I tried to make another appointment with my primary care doctor. And because I had flu-like symptoms that resembled potentially COVID, they would not see me despite the multiple negative COVID tests and flu tests. And they told me that if my shortness of breath was bad enough that I could just go to the ER. They also admitted to me that part of the reason why they couldn't get me in was because my primary care doctor had left, which nobody told me that my primary care doctor had left, and that they were having a problem with getting like enough like doctors in the office essentially to take care of all the patients. So I was just like thrown on the back burner. So yeah, that was the second time that essentially my tumor or something more serious was going on was essentially missed. And that time, like, I really think that it was kind of negligent of them to not actually take care of their patients. But that's my own personal opinion. And that's a whole nother topic for another day. On November 19th, 2021, which was a Friday, 2 days after I had seen my mom, I was really starting to feel sick again. And actually, that night, I started running a fever again. So I booked an appointment with a nearby urgent care, and I was so sick that night and I had a hard time breathing that I could not get comfortable in bed. I actually had to sleep in the recliner with my feet down because even putting my feet up and leaning back just enough would actually make my breathing worse. I was sick enough where my dog was even worried about me and he slept on my feet all night. I was running a fever. I just didn't feel good. I was having a hard time breathing. And when I got into the shower that night, I started to notice on the side of my neck over here, just enough swelling to kind of notice that there was a difference between the two sides, but I couldn't tell exactly what it was, whether it was like a lymph node or like my vein or something else going on. I just could tell that there was a little bit of swelling right here. The next morning, that swelling, that pressure that I felt in my neck became more defined, and it became pretty obvious that it was actually my vein sticking out, like right here. Obviously, you can't see it now, but at the time it was sticking out. And I essentially, in a weird way, was kind of in denial that it was something more serious. I just figured, you know what, I'm sick. It might be a weird lymph node swelling up, and I'm just going to go to this appointment at urgent care anyway. So I get to urgent care, they do another flu swab, another COVID swab. Everything came back negative like it did before. Um, but thankfully, the nurse practitioner listened to me when I told her, I'm starting to notice this weird swelling. I don't know if it's a lymph node. I don't know what's going on. And that kind of drew a red flag for her. She talked to her doctor at urgent care, and then she looked at me and recommended, you know what? You might have something more going on. It could be a blood clot. It could be like you had a virus and then now it's causing some sort of blood clot or like an infection. And she says, let's just send you to the ER and make sure you are okay. So my fiance had to drop me off. He dropped me off at the front door at Millard Fillmore Suburban Hospital, which is near Buffalo, New York. And I told him, you know what, don't bother coming back until I call you. Odds are I'm probably going to get discharged in a few hours. No point in you sitting here and waiting. Just go home and I'll call you. So I ended up in the ER. I don't remember how long I waited. I didn't feel good, so I just wasn't really paying attention to the time. I want to say I waited at least an hour and a half, 2 hours, which really isn't bad considering the crisis that all of the ERs have in terms of too many patients, not enough staff, not enough room. So eventually I got back to a room. I had a really sweet nurse. She took blood work. They put me on the heart monitor. I remember my heart rate being like, it was high. It was like anywhere resting heart rate between like 130s and 150s. Like it was pretty high. And my blood pressure was also crazy high. The PA came in, and come to find out, it was a PA I used to work with at another hospital. So he listened to me, listened to my story, and I told him everything going on. So at first he was going to just draw blood work and see what the blood work looked like. But because of the vein swelling in my neck, the attending doctor in the ER recommended that I actually get scanned. So originally I was scheduled for a scan of my head and a scan of my chest. Both of them required contrast. After some time and waiting, I got back and I went into the scanner. I was talking. I had a hard time breathing. I had a hard time laying flat. I just remember feeling like I just wanted to get the scan over with. I was having a hard time breathing. So they laid me down flat. Originally, I was supposed to get my scan of my chest first and then my head. I went through, got the scan of my chest, and I stopped on the scanner. Finally, the tech comes out, and she wouldn't make eye contact with me, and she just kind of said, oh, the doctor wants to review this, and something didn't quite come out right on your scan. You might need more contrast, but they want to review it first. So you're going to go back to your room, and then you'll probably come back and get the scan of your head. So she wheeled me back. That's when I started having some caution flags in the back of my head, and I was like, okay, well, something might be wrong. Something might be actually wrong with me, and I might have been downplaying this whole thing. Now, granted, when I was thinking in terms of downplaying my symptoms, I was thinking in terms of the past 2 weeks, not the past 2-3 months. So that's what was going through my head. After quite a bit of time, just sitting in my room waiting, finally the PA came in, closed the door, and I remember seeing his face. Again, I knew him. I had worked with him before, so I knew when there was something concerning. And he basically told me, we found a large tumor in your chest. We're going to have to send you to Buffalo General Hospital in the city because you need an echocardiogram done because it is, putting pressure on your heart, and we want to make sure your heart is doing okay. And immediately, just like that, I was having a panic attack. I remember hyperventilating and thinking to myself, oh my God, I have cancer. Oh my God, I have cancer and I'm going to die. It It was the worst feeling in my life. I sincerely thought that this was my death sentence. Um, Sorry. It was really hard. So immediately I called my boyfriend at the time, who is now my fiance. I called him freaking out, obviously, and telling him, like, you just need to get here, you need to get here, like, I don't want to be alone. And obviously, like, he was trying as fast as on his end to get to where I was. But then the nurse came in and said, hey, you might want him to hold off because I don't know how soon the ambulance will be here, but he might have to meet you at Buffalo General. So there was like a little bit of phone tag and trying to figure out like what to do with that. I also called my mom, freaking out. I probably caused a whole panic attack on her end because who wants to hear that their daughter has a massive tumor in their chest? Um, but when I say tumor in my chest, I should clarify it was like in my rib cage, like right pushed up against my heart, and it was a pretty big tumor. They had to give me some medications just to help calm myself down and relax a little bit. And then I was transported to Buffalo General Hospital. When I arrived, the nurse told me, like, like, get comfortable. I'll be in there in a second. I went into the bathroom. And I remember sitting in front of the sink and, like, washing my hands and just looking and staring in the mirror, like, oh my God, like, I'm going to die. I remember turning just super pale and just staring and having this mental, again, a panic attack. I felt like the wave of fear and like, I don't even know how to describe it, just like pure fear and panic and anxiety just all at once. And then I remember starting to cry, just staring at myself in the mirror, thinking about how my boyfriend and I didn't have enough time. Like we wanted to get married and have kids, and like I was just finally starting to love my career as a travel nurse. And I just felt so much, I just felt so scared, and I felt so much anger about my situation because I felt so cheated. Um, it was hard. It was, I don't even know how else to describe it. It was just terrible. It was a terrible thing. Eventually, I made my way to my bed, and I remember like the lights were off because I had a roommate and she was sleeping, and just staring out, and it was just staring at the city lights and thinking to myself, oh my God, when am I going to talk to someone? I need to talk to someone. Mind you, this was a Saturday night. um my nurse came in and she introduced herself to me, and I remember I probably looked like a crazy person, but I literally looked at her in tears and I was like, I need to talk to someone. I need to talk to a doctor. I need something. I need answers. I was so scared. She ended up getting in contact with one of the providers on call, um, who came up and saw me a little while later. When that provider came up, she talked to me and said, I have more questions than answers, just like you, unfortunately, but I promise you, you have multiple teams of doctors that are going to be working on your case. She's like, we're going to get to the bottom of this, but you need to remain calm, and try and get some sleep, which I was like, I don't know how I'm going to sleep. How the heck am I going to sleep? Um, and she ended up prescribing me Xanax to help me sleep, just a really small dose. And I asked the nurse, I'm like, do you think it'd be okay if I played like something? I needed something. And I know it sounds crazy, but when you are trying to relax and you are in pure panic, defense mode, anything, just the littlest things can help. I ended up playing like ocean noises, which that's not me at all when I try and sleep. But I just try to imagine myself like back on vacation next to the ocean. So, so I got through that. The next morning, I had the thoracic surgeon, which his team essentially is the one that ended up taking the lead on my case. They he explained to me all the different things that it could have been. It could have been, for obviously cancer. He listed different types of cancer. He also talked about how in some very rare cases it could actually be a tumor caused by like abnormal hair growth or like teeth. Believe it or not, you can actually have a tumor in your chest caused by teeth growing. So he was telling me all the different things that they could be, and he explained to me, what we need though is we need a biopsy and we need more imaging and all of that. So that later that day, I got a chest biopsy. Basically, when you get a needle biopsy for a tumor in your chest, what they do is they give you, in my case, the first time, they gave me some light sedation, nothing that completely knocked me out. I remember bits and pieces of it, but I think of it as more of like a dream where you only remember like little bits of it than anything else. They gave me that pain medicine, and what they did is they put me in and out of the scanner a few times. They mapped out where the tumor was and where they wanted to enter my chest. They actually like went into between my breasts. And then they used the CT scanner to guide themselves to my tumor. Unfortunately, the first biopsy came back inconclusive because the middle of my tumor was necrotic, meaning dead. Which with my type of cancer that I was later diagnosed with, that's actually very common. So those biopsies were on a Monday. Come to find out Wednesday morning, when the results came back inconclusive, the hematologist and the oncologist through the hospital came in to see me. They did warn me, this is probably, there's more than likely it's some sort of type of cancer, but we have to figure out what it is for sure. And they they advised me that, we really should get a bone marrow biopsy while we're here, and we should get another tumor biopsy. This was on a Wednesday. It was actually the Wednesday before Thanksgiving. So they had to squeeze me in to avoid making me wait until the next Monday for biopsies, because obviously I was very dependent on these biopsies because of how aggressive my cancer was and how fast things were growing. So my second biopsy of my tumor required, instead they did an ultrasound guided biopsy. Originally, I was told at the time that I was going to receive sedation for both biopsies, but when I got to the essentially where they were going to do the biopsy, I was told because I had eaten that morning, even though at the time we didn't know that I was going to need these biopsies, by the way. So that because I had eaten in the morning, they couldn't give me any sort of sedation, even though it had been like 4 or 5 hours. And that I was just going to get pain meds. And because of the amount of pain meds I guess you can get, they saved all of the pain meds, IV fentanyl, for when I had to get my bone marrow biopsy. So this biopsy, the only thing I had was lidocaine through a needle. I tolerated it. It was terrible though. It was so uncomfortable and scary. But thankfully they were able to get a decent biopsy for diagnosis. And then when I had my bone marrow biopsy, it was terrible. I could make like a whole nother video on how terrible bone marrow biopsies are, and I'm sure I probably will. But let's just leave it at that. It was terrible. I couldn't get sedation for it. So it made it that much worse. I guess the tools that they use at Buffalo General are slightly different than what my cancer center used. So it was like a little more invasive and caused potentially like more pain. So that was rough. I got through it. I was then there until the Saturday after Thanksgiving. So I was in the hospital for 7 nights, 8 days. And eventually I ended up having to get a follow-up plan. I had a lot of issues with the oncologists at the hospital there. They were not very communicative. They really didn't give us like a lot of information. And I had told them that, you know, for obvious reasons, I wanted to go to a dedicated cancer center, which thankfully in my area, we have Roswell Comprehensive Care um, Center. It is an awesome cancer center. They are amazing. And I told them, you know, I want to get treated at Roswell, just given my situation. And I was essentially like referred to them, but Roswell wouldn't contact me until they got my biopsy results. So I was finally sent home that Saturday and was told I had to wait. However, I also was promised by the oncologist at Buffalo General Hospital that they would promise me to call me about my biopsy results, which is what I wanted. I just wanted to know. I wanted an answer as to what was going on. And sitting and waiting and not knowing what was going on is just, it's terrible. It's so hard to deal with. I want to say it was, I got out that Saturday. Sorry, I have to think about it. I got out that Saturday and it was sometime midweek the next week. I finally got a call from Roswell Park. I never got a call from the oncologist at Buffalo General. They never told me my results. I found out that I had some sort of lymphoma when the lymphoma department at Roswell called to schedule an appointment for that Friday. Yeah, I found out through that. Worst way to find out that you for sure have cancer and what type of cancer you have. That whole week, I remember thinking to myself, I really hope it's Hodgkin's lymphoma, because there is like this, I guess the best way to put it is like this false stereotype that Hodgkin's lymphoma is like the quote unquote better lymphoma to have because it's a lot more treatable, which in some cases it is, but in other cases it's not. And I was just so scared to have non-Hodgkin's lymphoma. I didn't really fully understand like what that all entailed. I tried to Google things and I think that just made it 10 times worse. And I knew I shouldn't have done it, but I like the anxiety and just you have so much information at your fingertips that you feel like you need to access. And it was hard to like not just let it go for a few days. Um, Finally, I met with Roswell Park. They were awesome. My boyfriend, now fiance, Tyler, he was so apprehensive about all these doctors. He was really fed up with the doctors that we had to deal with at Buffalo General, especially since they did not communicate anything with us. And Roswell, like, it only took him like an hour being at Roswell to be like, this is the place you need to be. They were awesome. And no, I'm not like paid to talk to like brag about them. I just loved them there. They had everything planned out. They even had a folder for you to put all of your like medical files in. And I walked in the door and immediately the nurses were just so sweet. They took my blood work. And when the doctor came in, he had a plan all laid out. And that was the first time that I had hope, that I felt like, you know, this wasn't a death sentence. And I was diagnosed at this point with primary mediastinal large B cell lymphoma. The next week, within 1 week, I had started chemo, a week from that Friday. Within that week, I had one procedure to put in my Metaport. I have a Metaport. I'll talk about that at some point. And I had 2 more biopsies, one of my bone marrow, one of my chest. This time I got pain meds and sedation. Basically, they wanted to test for extra genetic markers that they didn't have enough sample of before, just to make sure that I had the right diagnosis. But they treated me with so much respect. They educated me. They kept me informed. And I just felt so supported there. For treatment, I got 6 rounds of REPOC, which is a type of chemotherapy. I plan on making like a whole new video on that and talking about chemotherapy. because there's just so much to that. And then I went into remission officially as of April 2022. Unfortunately, about 5 months later in September 2022, I found out that my cancer was back. But I feel that that's a story for another day. So stay tuned on that. But as of January 2023, I am still alive and well and here to tell the story. But yeah, that's my diagnosis story on how I turned from an RN to a cancer patient. If you want to know more about my story or you want to learn more about young adults with cancer, please like my video and subscribe to my channel. I really hope I can grow this channel to be a nice support system for others in my situation.